But let's begin with a very worrying story that has really gripped the attention of millions of people, both online and offline. A new swine flu that has the potential to become a pandemic has been identified in China by scientists. The strain of the flu could originate from pigs to begin with, but people could have little or no immunity to this virus. It's unclear at the moment. It is named G4, that's what the virus is called, and it is genetically been descended from the H1N1 strain. Now remember, the H1N1 strain that caused the pandemic back in 2009. So this virus can actually, the virus strain can actually be traced back to that. The virus is spreading silently in workers who work on pig farms in China, and many scientists are calling for this virus to be urgently controlled in order to avoid another pandemic. So there are big questions that really need to be answered, a lot of clarity that is needed. We'll be joined by a panel of expert doctors to try and understand what really is happening with this new virus and the pandemic potential that it has, and should we really be worried. We have Dr. Rajveer Purohit with us. He is the director of reconstructive urology and a professor at a hospital as well. He's joining us from New York at the moment. Thank you so much, doctor, for being with us. A lot of questions and you know, a lot of panic, if I can say. Is human to human transmission possible in the virus? I think that's the big question that everyone wants to know.
Well, first of all, good evening to all your viewers in India. What's important to remember is this is a very sort of preliminary report, and this is not the time to panic for the public. So this was, the paper was originally published in the Proceedings of the National Academy of Sciences, which is a very prestigious journal. And these Chinese researchers looked at 30,000 pigs, took nasal swabs of the pigs, and tracked over various different variants of the H1 and influenza viruses in these pigs. They found that one strain seemed to consistently be present over the course of the last 4 years, from 2016 until now, and that strain was this G4 H1N1 strain. This strain was increasing in the population of pigs over time as well, which was concerning. But what was probably most concerning from this paper was the fact that about 10% of workers who were handling the pigs tested positive for having this G4 H1N1, and about 4.4% of the population who lived around this area also tested positive for the G4 H1N1 disease. In addition, what was concerning about this was that they found that there was enough genetic variability from the G4 H1N1 strain that most people who had it were not immune to it. That is, if you previously had the influenza virus, you wouldn't be immune to it. Now, that said, so those are the things that were concerning about this. So it's increasing in a number. It's related to this swine flu, which is another variant of the H1N1. It seems to replicate in the upper respiratory tract of humans, and it seems to be easily transmissible between pigs and humans. But what we don't have any evidence for so far is that there is no human-to-human transmission of this disease.
That's the big question, yeah.
And the paper did not look at that specifically. So, and it also is not clear that there's any symptoms that develop from this disease. So what's really important is that we take a step back. You know, all through history and since humans have been interacting with animals, these kind of viruses will keep popping up in people, and we get these animals act as hosts. But it's important to remember that they don't necessarily cause diseases, and they need to undergo mutation to become much more dangerous.
You're striking a slightly optimistic note, and I'm glad. But Dr. Rajesh Chawla is also with us. He's a pulmonologist at the Interspecies Hospital in Delhi. Appreciate you, Dr. Chawla, for taking the time of day. I have to ask you, are you at all worried, and should we be worried? Because there is pandemic potential that has been associated, though that term has been associated with this virus, and I think that's what's got people really worried about this.
You just heard, it's a paper published in the National Academy of Sciences in the Proceedings, and it is a very preliminary. They have found a virus which is G4EA-H1N1, like it's a extra virus which is found in the pigs. And they have just found that it has a potential to multiply in humans. So, Corona is not going to be the last pandemic. We're not worried because it's so preliminary. A lot of viruses like this have been isolated earlier. Everyone has not converted into pandemic. Of course, it's a concern, but I think that it has a potential. They have still not found the human to human, and it has only been found in pigs. And it is a warning that we control in pigs. Probably it will not be spread to the humans.
Okay, so and, very crucial that if it can be controlled in pigs, then it won't spread to humans. And I think that's something that scientists are saying as well, that it needs to be controlled in pigs and humans need to closely be monitored. We also have Dr. Rajesh Parekh with us. He's the Director of Medical Research at the Jaslok Hospital in Mumbai. He's also co-author of the book on the coronavirus and all you need to know about the global pandemic. Dr. Parekh, you wrote about this in your book, didn't you?
Yes, we did it in February. When we were working on the book, we warned of precisely this kind of a scenario, knowing that coronaviruses have the ability to swap genes in a recombinant manner. And there are two types of recombinations. One is which is homologous with the same another species of coronavirus. And it can also get into what is called a heterologous recombination with H1N1 and others. The problem with this, Rishika, is that the coronavirus spreads. The current virus, SARS-CoV-2, has a great spread, but lethality is low. And H1N1 virus can have a lower spread, but a much higher lethality. So when these two combine, and they would combine in a swine, in a pig, when they combine, then you have the added combination of a great spread and high lethality. This is what we were concerned with when we wrote the book in February. And unfortunately, the study that has appeared in the proceedings of the National Academy of Sciences, American Sciences, has validated that concern.
All right, but how concerned should we be at this stage, given that, the human-to-human transmission has not been established, there's no evidence of it yet? How concerned should we be?
We need not be concerned. Enough things literally on our hands to be concerned about.
Right.
But scientists, and they have to now ensure that the interspecies jump from the pig to the humans doesn't occur. This kind of jump has occurred in the past with the swine flu, of course, and currently with the SARS-CoV-2. Now they have to ensure that this doesn't happen. That's easier said than done.
All right. Dr. Purohit, do you want to come in there? Ensuring that the interspecies jump doesn't happen. There's a virus that's been found in pigs. Therefore, scientists are saying that controlling the virus in pigs is key, monitoring humans is key. Is that possible? And how close does the scrutiny and monitoring have to be at this stage?
Well, let me just correct it. So the PNAS article actually showed that the interspecies jump has already occurred.
Okay.
So they found that, as I mentioned earlier, that 10% of workers actually had the virus in their bodies, and they found that 4% of the local population were exposed to the virus. So the jump has already occurred. The question is, will it cause symptoms in these humans, and can human-to-human transmission occur, which is a lot more dangerous once that happens. So right now we have no evidence that human-to-human transmission will occur. And in addition, we have no evidence that symptoms can occur from this virus. What's concerning is if there's a mutation to this virus that allows symptoms to occur, because we know the virus can replicate in the human upper respiratory tract.
Right. Dr. Chawla, would we be having this conversation if we were not in the midst of a pandemic? How frequent are there studies of this nature that are published that, usually wouldn't get the kind of attention that they are getting at the moment?
No, time and again, some kind of virus has been coming, and we have been discussing about these. And this would also have been discussed even if the pandemic was not there. It is just to raise the concern and to control at this time so that as you just heard, the human-to-human spread does not occur. And control this disease right there so that any mutation which comes in this virus and it can spread, the infectivity goes high and the fatality of this disease is high, as you heard, as compared to the coronavirus.
Dr. Parekh, what does history tell us, about the COVID-19? What are some of the lessons from the inception of the COVID-19 that one can learn, which can in fact be applied to a potential pandemic virus?
There are several lessons. I won't go into the lessons that we have ignored, which we have learned from past pandemics where something like this has occurred. Of course, I do need to correct myself. The PNA article does in fact mention that the interspecies jump has occurred. I meant to say the human-to-human transmission, that we have to be careful about it. I think the first and the most important lesson that we need to learn from the current pandemic is politics, power, money, military arsenals will not insulate any nation against a pandemic of this nature. What is needed is science, logic, compassion, and of course the willingness of healthcare workers to put their lives on the front line. The other lesson, important lesson that we have to learn is that as long as some of us are unsafe, all of us are unsafe.
Right.
If one of us is unsafe, the rest are unsafe. We cannot be spending paltry thousands in Africa and billions in the West, and more important, even larger amounts on arsenals, which destroy us, and ignore the existing inequity in healthcare that occurs between nations and sadly even within affluent nations. So if we don't correct these, then the chances are high that we are going to repeat the same mistakes again.
Right.
In our book, we have paraphrased John Donne to say that when the bells toll for a victim in Zimbabwe, they toll just as loudly for the senators in Washington.
Okay.
I think if we understand this, we would have moved on.
All right. I think you're raising a much larger point here. But Dr. Rajveer Purohit, if I can come back to you, this again is a swine flu, and, we are seeing symptoms or rather strains of the virus, the G4 virus, that are being found in those who work with pigs. Explain to our viewers the significance. H1N1, of course, is where the strain is coming from. It can be linked back to that pandemic. But explain to us how pigs are susceptible to both avian as well as human influenza viruses like this kind.
Well, I mean, the pigs, and there's a few species of animals that can harbor these viruses, can harbor influenza viruses. And we know in general that animals that come in contact with humans are hosts for these viruses. So one of the concerns about this H1N1, the swine flu from the 2009 pandemic, was that it infected a lot of people. Fortunately, the death rate was not very high. All we need to have is a mutation that occurs that makes the death rate even higher, and that would make this a far more dangerous, potentially a far more dangerous disease. So, this is what the concern is at the end of the day. There's a few species that can harbor these viruses, and it's always in areas where humans are coming in contact with animals, and particularly like factory farming or large-scale animal farms, that you get these infections. So that happens in China. It happens in sort of the margins. So you may be eating meat and thinking you're safe from things, but the diseases are occurring because you're eating meat, because these animals have to be harvested for their food.
Right. I have to also ask you, are there any particular age groups that are more susceptible? What can you tell our viewers? Should we sitting here in India be concerned? Are there do's and don'ts associated with this?
Well, in the original PNAS paper that was published, they interestingly enough found that there was a larger percentage of infections among younger people than older people. But, it's unclear what the source cause of that is. It may just be because younger people were more exposed and were working on these farms to begin with, unlike older people who may have had more sedentary jobs. So we don't know what the cause of this is. And again, we don't know whether any symptoms will develop and whether younger or older people will be more susceptible to symptoms.
All right. So there is so far no, no evidence of human-to-human transmission. That's something that still needs to be ascertained, and no clarity yet on what the symptoms are going to be. I want to then just bring back Dr. Chawla into the conversation, because we're dealing with, once again, a lot of unknown here, a lot that is not known about this particular, viral infection, the G4 that we're talking about. Once again, how does the human race then respond to it? What should we be cautioning against when you don't know, what really this viral strain is all about and the potential damage it can cause?
So right now we're not aware of. So, but now, if you see last about 5 to 10 years, one or the other epidemic has been occurring all over the world, predominantly in the Asian region, in the China, Hong Kong. You had a lot of viruses in the Middle East, and the SARS virus. Now we have to live with these viruses, and they'll keep on. Corona is not going to be the last. So we have to take precautions so that the spreads don't occur.
All right.
You cannot prevent these antigenic shift and antigenic drift in these viruses. New mutations will occur, and how they will behave, you really don't know.
All right.
I mean, as the world develops, you are going to have all this. So we have to learn to live how we can protect ourselves from these pandemic in the near future.
All right. So we have to learn to live with it. I'm completely out of time, but Dr. Rajesh Parekh, very last 1 minute to you. Do you agree? We just have to learn to live with these. So, the usual practices that now one has learned, which is hand hygiene, masks, sanitizers. Is this the general and perhaps the only guard that we have against potential pandemic viruses of this kind?
Well, hopefully it's not the only guard we have. We have to look forward to a vaccine, which possibly will be ready next year. But I think what we have to guard against, I wonder if you have the cartoon from the New Yorker, which I sent you. Do you have time to put it up? Otherwise, I'll just describe it.
I unfortunately have it on my phone, but yes, please go ahead and explain it.
Yeah, so you have a cartoon in today's New Yorker, or rather yesterday's New Yorker, which is called herd immunity. There is a herd of sheep, and the sheep are saying things like, I'm fine, nothing is going to happen, everything is going to go okay. And I think what the cartoonist is alluding to by immunity is immunity against science, against logic, against common sense. So as long as we listen to our scientists, as long as we get our priorities right, that is going to be as important, if not more important, than washing hands.
All right. Appreciate you, gentlemen, for taking out the time of day and answering those questions so patiently. I think it's created a lot of anxiety and a lot of questions, and we hope that some of those questions, have been answered in this broadcast. Thank you so much for taking out the time of day to answer our questions.